So, like Pelu mentioned, definitely the side on the, or excuse me, the clinical side where clinicians, administrators, all of those folks are facing challenges that they hadn't faced before, being asked to adapt to things that previously, and I'm sure everybody on this panel knows this, prior to COVID, trying to have a conversation about the value of telehealth and the value of some of these remote services was a challenge because nobody wanted to necessarily change rapidly or take on some of the new requirements that these processes would take. But as COVID has hit, we've seen obviously the clinical adjustments that have been made, but then also on the patient side. So a number of our clinicians, part of the challenge that they were facing is that these patients hadn't been used to this process before. So not only was it the experience of the health system trying to transition to something new, they were also putting a new expectation on the patient that they would have to adapt to. And so we've tried to tackle both sides of that. And of course, much of that goes into the design and the UX and some of the workflows. And as we've rolled those out with different clinics, there's a unique challenge to almost everyone, just because these patient populations are so different and, maybe going through, like Pelu mentioned, a different stage of this pandemic, and therefore either are fully committed to being remote and keeping up with their health in that space, or pushing back a little bit and feeling like this is silly. I don't want to have to be doing this. I don't want to have to learn something new. So those have been really the challenges that we've seen. And it definitely adds a different dimension to what the clinical staff is facing when they're also having to train patients on these things.